Good evening. My name is Diana St.Fleur, and we will be talking about Lucy's assessment and her situation. So, some of Lucy's strengths that I have noticed is her memory. Her memory is still intact. She has mentioned that she doesn't recall ever having to call 911 when her partner Julia was alive. She doesn't even remember having dizzy spells before her partner Julia passed away. Some concerns for Lucy that I do have is her dizzy spells, that her knees are weakened, and these dizzy spells and her weakened knees are causing her to fall, which is in turn causing her to call 911 more frequently. And in having these dizzy spells and falling, my main concern is her falling and hitting her head. We do need to get a little bit more information from Lucy, and what I would ask is if she does remember the first time she got the dizzy spell and what she was doing, if she has been taking new medications, if she ate something new, if she was exposed to anything new. So anything that would trigger these dizzy spells and weaknesses in her knees, or if it's just an onset that's just coming out of nowhere. My priority with all of the concerns for Lucy is definitely the dizzy spells and her falling again, and in falling in turn hitting her head, and having a concussion, a contusion, even blacking out, cracking her head open, even worse, her passing away from hitting her head so hard on the floor. So consider multiple different interventions we can consider for Lucy would be to see if she can get some help in the house. Maybe she's doing too much that's bringing on the dizzy spells because her knees are weak. She did have surgery on her knee in the past, meaning if she can get a home health aide, someone to help with groceries, help clean, help cook, just little things like that. I would recommend to refer Lucy to maybe get some physical therapy, maybe to get some knee strengthening exercises to help strengthen her knee. Maybe even, if all else, draw some labs, see what is the underlying cause of these dizzy spells that Lucy is experiencing. So my conversation with Lucy would go as follows. I would ask her again, when does she remember the first time she had these dizzy spells? What she thinks has brought it on? Is it, maybe a new medication? It could be from her worrying because, she no longer has her partner. Just little things like that. I am also concerned, which I did forget to mention, the fact that, she doesn't really have anyone to come see her. That, her neighbor comes once in a while, her partner's son comes sporadically. That she is left in the home alone for such a long period of time that, God forbid she does fall and she's knocked unconscious, that nobody would realize that she fell and is on the floor unconscious for days on end, even weeks, and could in turn be fatal to Lucy. Thank you.